If you're dealing with hip pain right now, you might want to pause your walking routine for just a moment. That sounds counterintuitive, right? Doctors always recommend staying active, keeping the body moving, pushing through discomfort. But here's what many people aren't being told. When a hip is locked or compressed, continuing to walk without first restoring mobility could actually be adding more stress to an already stressed joint. There is one specific chair movement that physical therapists across America are now teaching their patients before they even attempt to walk, and by the end of this video you're going to know exactly how to do it from the comfort of your own home. This technique has helped thousands of people who are worried about their hip health, and it might just change everything for you too. Now, let's explain why walking on a compromised hip could be working against you right now, because once you understand this, the solution is going to make perfect sense. The hip joint is designed to be one of the most mobile joints in the entire human body. It's a ball and socket joint, which means it should move freely in every direction. But here's what happens when someone sits at a desk for 8, 10, 12 hours a day. Here's what happens when people drive to work, sit at their jobs, drive back home, and then sit on the couch to watch TV. The hip flexors, those muscles at the front of the hip, they start to shorten. They get tight, they get restricted. And when they shorten, they pull the pelvis forward into what physical therapists call an anterior tilt. This creates compression in the hip socket itself, and now that beautiful ball and socket joint that was designed to glide smoothly starts experiencing increased friction and reduced range of motion. So what do most people do? They feel the pain, and their instinct tells them to move. Their doctors say walking is good for them. Their friends say they just need to stay active. So they lace up their sneakers and head out for a walk around the neighborhood. But here's the challenge. With every step taken, that compressed, restricted hip joint is being asked to perform a range of motion it may not be ready to handle. It's like trying to open a rusty door hinge by forcing it open and closed over and over again instead of applying some oil first. The joint isn't being properly prepared. Mobility isn't being restored first. There's increased friction in the joint, potential irritation to the cartilage, and inflammation in the surrounding tissues. This is why so many people in places like Chicago, Dallas, Phoenix, all across this country, they walk and walk and walk thinking they're doing the right thing. And their hip discomfort just keeps getting worse. Dr. Michael Reynolds, a licensed physical therapist with over 15 years of clinical experience based in Austin, Texas, spent the first half of his career giving the same general advice everyone else was giving. Keep moving, walk it off, stay active. And he noticed patient after patient coming back to him, frustrated, discouraged, some of them eventually being referred for surgical consultations because the root cause of their problem was never properly addressed first. The hip was locked, it was compressed, and the standard approach was just adding more demand to an already compromised joint. Everything changed for Dr. Reynolds when he attended a medical conference in Boston about 5 years ago. A colleague presented peer-reviewed research on something called hip capsule mobilization. The research demonstrated how a simple seated movement could actually help decompress the hip joint, restore the natural spacing between the ball and socket, and support the body's natural healing processes. Dr. Reynolds was skeptical at first. How could one simple chair movement accomplish what months of walking and general exercise couldn't? But he incorporated it into his treatment protocols, and the results were remarkable. Since then, physical therapists and orthopedic specialists across the country have started using this exact technique with their patients. Here's the movement, and pay close attention because the details matter. The person sits in a sturdy chair, not a soft couch, but a firm chair with feet flat on the ground. The knees should be bent at roughly 90 degrees. Now the leg with the affected hip crosses at the ankle over the opposite knee, creating a figure-4 position. Most people stop here. They think this is just a simple stretch, maybe something they learned in high school gym class. But this is where the real benefit begins. Instead of just leaning forward like in a traditional stretch, the focus shifts to something completely different. The person actively pushes the crossed knee down toward the floor, while simultaneously trying to lift that knee up against their own resistance. Push down with the hand. Lift up with the leg. This creates an isometric contraction, and it should be held for exactly 5 seconds. Not 2 seconds, not 10 seconds. 5 seconds of this pushing and lifting engagement between hand and leg. Then, and this is crucial, complete relaxation for 3 seconds. Let everything go, breathe out, and then repeat this push-lift-hold sequence 5 more times. What happens during this movement is absolutely fascinating from a physiological standpoint. According to Dr. Reynolds and other leading physical therapists, when that isometric contraction is created, the deep rotator muscles of the hip are activated. These are muscles that most people have completely forgotten how to engage. These muscles, the piriformis, the obturator internus, the gemelli, they're responsible for stabilizing and helping decompress the hip joint. But when people sit all day, these muscles become dormant. They stop functioning optimally. And the larger muscles, the glutes, the hip flexors, they try to compensate, but they end up creating more compression instead of less. By activating these deep rotators through the isometric contraction and then immediately relaxing, the neuromuscular connection to the hip essentially gets restored. Those dormant muscles are reminded of their function. Blood flow to the hip capsule increases significantly, and space can be created within the joint itself. After just one round of this exercise, most people report feeling a noticeable difference. The hip feels lighter, there's less restriction, less catching sensation, also that deep, aching discomfort that's been affecting their sleep quality. Here's what the experts recommend. Practice this chair movement first thing in the morning before getting up and walking to the bathroom. Do it again at lunch after sitting at a desk all day. And do it one more time before bed. 3 times a day, 6 repetitions each time. That's less than 5 minutes of total investment, and it can significantly improve how the hip feels and functions. Dr. Reynolds shares the story of a patient from last year, a woman named Susan from the Austin area. She was 63 years old, had been dealing with hip discomfort for almost 2 decades, and her orthopedic surgeon had been discussing surgical options with her. She was anxious about the prospect of surgery, concerned about the recovery process, and she came to Dr. Reynolds hoping to explore all her options first. He taught her this exact chair movement on a Tuesday afternoon. By Friday, she called him with excitement in her voice. For the first time in years, she could get out of bed in the morning without that sharp sensation in her hip. She could walk to her mailbox without holding on to the fence. She decided to postpone her surgical consultation to continue with conservative treatment. That was 18 months ago, and she still practices this movement every single day as part of her morning routine. Now, the experts are clear that individual results vary. Every body is different. Every condition is unique. Some people have significant arthritis, labral tears, or other structural issues that may require medical intervention. It's always important to consult with a qualified healthcare provider about your specific situation. But what physical therapists like Dr. Reynolds are suggesting is that before making any major decisions about hip health, before exploring more invasive options, it may be worth trying conservative approaches first. Try this technique for 2 weeks. Just 2 weeks of this simple chair movement, 3 times a day, and observe how the body responds. The beautiful thing about this technique is that it costs nothing. No equipment is needed. There's no need to drive to a gym or a physical therapy clinic. Just a chair and 5 minutes of time. And unlike walking on a compromised hip, which potentially adds stress to a restricted joint, this movement is specifically designed to help unlock the joint, restore mobility, and prepare the hip for comfortable, pain-free movement. If this information was helpful, please hit that like button down below. It helps this video reach more people who are dealing with hip discomfort and looking for solutions. And for those who are new to this channel, consider subscribing because videos like this are released every week, sharing the techniques and strategies that top physical therapists use with their patients to help them move better, feel better, and enjoy life without constant discomfort. The journey to better hip health starts with one decision, the decision to try something different. So grab a chair, try this movement, and leave a comment below sharing your experience.